their goals as a personal trainer, you have to look a certain way. A lot of people don't want to go in the Gold's Gym, American Family, because you got people in there, they're really well built.
Yes.
So most people have that fear of will people laugh at me?
Wow.
Will I be accepted? But what I do, I bring them one-on-one.
That's a good point. I want to just take a moment for a minute. You're now talking to Asad Haith. He's the president and CEO of Asad Haith Fitness LLC. We also have Professor Malvina Goodman, and I am Mike Edwards. Callers, be aware at 9:30 we're going to have call-ins. You're going to be able to ask Asad Haith some questions about personal training and physical fitness. Also, we have Professor Malvina Goodman here. She has a background and 3 master degrees, one in divinity, another one in counseling, and the other one is in
counseling.
in counseling. Thank you very much there. And if you have any questions concerning business development or developing a business, such as what Asad Haith has done over here at the Seed Institute, we want to help you prepare yourself for your goals in 2014. Now, Asad, cardio, you said it's going to be a very important part. Now that you've done that assessment and we've set those goals, where would we be working out at? Where were some places you would have me go? I'm thinking about the park. I'm thinking about potentially the gym, and the gym doesn't have to be a place that we go.
No, sir. Well, it's several locations you can work on at. You know, I have my own personal training gym set up. I'm a membership of another gym. You may have your own equipment at your house. I will come to your house. Say you want to meet at a recreational park, you want to walk the track. My duty is to be there and support you, as well as to give you sound advice in personal training. And not to mislead you, but give you sound advice and give you realistic goals to achieve.
So what you're saying is that you're a personal trainer, but it seems like you're also providing like some coaching with that too. So it's definitely individualized in terms of what's comfortable for the customer or the client, that we can meet at a gym or we can meet outside. So you're going to walk alongside them to help them to achieve their goals.
Yes, I will.
That's an excellent business plan there.
Yes, I will, because I found the number one fact in working out, a lot of times you can become selfish and not look at the person goal, but have your goals.
Right.
You must be flexible because this is your customer. This is your client. You got to make them feel comfortable, feel satisfied because they're spending their money with you. And then you build a relationship with a person. When a person knows you care about them, they have a tendency to want to be motivated.
That's right. That's right.
So it's all about caring about a person.
So it's all about developing relationships is what you're saying. And so, because I think you mentioned maintenance.
Yes.
So your 5 different areas that you kind of look at when you're doing an assessment, maintenance. And I think about the recovery process. When people are recovering from whatever that may be, drugs and alcohol, gambling, sex, whatever it is, it's easy to stop.
Yes, it is.
But staying stopped, the maintenance of your program is really where a lot of people fall down. It's like, how do you maintain, the enthusiasm of your recovery once you get it? Or I've lost this weight, now I have to do the maintenance in that. So how many people, what's the percentage of people who are able to maintain once they've achieved their goal?
Well, Professor, it's a small percentage, maybe 2 to 3%.
Wow.
But you still must encourage the other ones. Because, without encouragement, what would you have in life? This brother here encouraged me to push forward every day on my business. And I have goals set up. I'm LLC now, and things look bright. So one must have concern about the other individual.
That's exactly
whether they fall off or not, whether they pay you, you must show concern. I check on a lot of my clients. How you doing? I haven't seen you in a while. Just to let them know it's not about money, it's about your overall wellness of life.
That's so important too. Let me just say this and I'll turn it over to you. That is really important. I was in class and I was, talking to students about, we establish goals. And sometimes you're dead on those goals and you're achieving, but there's times when you may fall off. And a lot of times we'll beat ourselves up and not continue to move forward. But I always say, regardless of whether you're working on the goal or not, if you're not working on it, identify that I didn't and just get up and keep it moving versus like, whatever we start telling ourselves, these stories, we got stories that we tell ourselves to keep us from just getting back up and getting back on, So most successful people, Michael Jordan became great because he practiced.
Yes.
Oprah Winfrey became great because she practiced. So people that practice their craft, whatever that is, you know, it's not that they didn't have failure. They just decided that they were not going to be defined by the failure.
Now, I wanted to bring this up. I was looking online, and listen to this aside, and tell me where we're at. A personal trainer is a fitness professional involved in exercise prescription and instruction. They motivate clients by setting goals and providing feedback and accountability to clients. And I know this is what you do because we talk so much. Trainers also measure their clients' strengths and weaknesses with fitness assessments. These fitness assessments may also be performed before and after an exercise program to measure their clients' improvements in physical fitness. And they also may educate their clients in many other aspects of wellness besides exercise, general health, nutrition guidelines, and then we go on. And I'm thinking about that, and I'm looking at the correlation again, Professor Goodman, between the mental health and the physical health and how this is done. They motivate clients by setting goals and providing feedback. So let's take a typical client now. I come to you and I'm 60 years old. Approximately 55 pounds overweight. Where do we go?
Michael, that is an easy question because I have a variety of age groups. And first, like I said, I'll make assessment with you and I ask you as an individual, what do you look to achieve? Once he tell me what he looked to achieve, I would sit down and I would chart out a direction for him. I would say, okay, well, we will start you off with maybe walking for maybe 15 minutes a day.
Excellent.
I want you to do 15 jumping jacks.
Okay.
I want you to do 10 sit-ups.
Okay.
I want you to do 15 toe touches, and I'll leave it at that.
Okay.
Once you achieve that, I give you 4 weeks. If you feel comfortable with it, you feel like you can do more, we add 2 more to it. Because it's about getting the person into it.
It
you know?
is.
Not rushing them because you got to look at his age factor.
Now there has to be a way to measure the advancement of the individual. Now, I want to defer to Professor Goodman. I come to you, Professor Goodman, and I have an emotional challenge. I'm lacking confidence in myself. And so with that assessment, how would you measure maybe a month from now or 2 months from now my successes?
Well, I mean, again, it goes back to establishing goals. So the person would definitely have to establish goals. And so from a mental health perspective, I mean, there would definitely have to be something behavioral going on there would be something that they are demonstrating outwardly. I mean, their affect definitely would change, you know, if they're working on, you know, the goals that they have established. And so that would be, you know, and when it comes to mental health issues, it could be as simple as getting up out of the bed and eating, because sometimes people don't eat.
Excuse me, Professor Goodman, Saad Haith, we have a call.
Okay.
Caller, welcome to Seeds of Wealth and Wellness. You're on the air.
Hi, how are you?
Wonderful, wonderful.
I'm calling, I'm trying to lose some weight really in the midsection area. I'm not a big girl, I'm really small, but I have the midsection. So can you tell me some things that I can do to lose this midsection?
Well, Hassad, we have a guest right here, and she's asking you how would she lose her midsection?
Yes, that's a very important point that everybody would like to achieve, because as you get older, your metabolism slow down. And it's a terminology in fitness. They call it for the females pear shape and for the men apple shape. And what I would get you to do, I would tell you first and foremost, drink at least a gallon of water a day, because that helps to increase your metabolism. I would start you off on a light routine, walking, basic calisthenics, jumping jacks, toe touches. These are things that will speed your metabolism. And also, very important, you will have to watch your diet.
Okay.
Caller, do you have any more questions for Hassad?
Thank you. That's very helpful, and I'm quite sure somebody would definitely be calling back.
Okay, and Hassad, tell our caller how they can reach you. And thank you, caller, for calling us on the air.
Yes.
I'm right now. I'm actually calling from my car.
Fantastic.
Okay.
But thank you for calling from your car.
All right, but thank you.
You're very welcome.
Wow, great, wonderful.
Given your information, and if you have a website, let them know that.
Yes, you can go to my email at rod, R-O-D, Haith, 08 at gmail.com. And my personal training business number is 804-328-1600. You can call me any time of the day. We will set up a consultation. I will set you up with a meal plan, a one-on-one training, and we will make progress to get the weight off you.
Now, do you have a website?
Yes, I do.
Give us your website address.
All right, it's www.asadfitness.com.
How am I spelling Assad?
ASAD.
Okay. Fantastic. Now,
So that was really interesting. So you talked about the pear shape for women
Yes.
and the apple shape for men. Let's see, the pear shape. Okay, that's just, interesting dynamic.
Yes.
And I like what you're talking about, the metabolism, drinking water and doing calisthenics, that would help
Yes,
to speed up your metabolism, which means then that would decrease the amount of weight that you would be gaining.
Yes.
Wow, so something real simple.
Something that's simple.
And so that's the thing about a lot of times things that's so simple for us, we think that, well, I can do it anytime. I can do it anytime, but it's like there's no time like now.
That's right.
Now, back to the 60-year-old. We started off walking and we got the regimen a little bit down a path. And so after about 4 weeks, what would be the process of kind of measuring the success?
Well, it's a flexibility test.
Okay, okay.
You can take him through a basic stretch test. Sit him down and see, can he reach, how far can he stretch forward.
Okay.
It's called a flexibility test because you can measure how far he's reaching. You can take him through somewhat of like a basic endurance test for his age now, because you must keep in fact he's 60 years and over.
Okay.
So you would get him to do a cardio routine, and then you will monitor his heart rate. That is very important dealing with metabolism and burning fat. You have your heart rate at rest and your heart rate, how many times it beat when you're working out.
That is very, very interesting. Now, Professor Goodman, too, Assad has done an assessment with the individual, walked him through it, and now he's measuring their strengths. Now, for another individual with the emotional assessment, how would a social history, what kind of questions will be asked for a social history on a person?
You definitely want to know what their, family background is. That's important to know about their family background. It's important to know, about relationships. It's important to know about, and relationships could be, just who lives in your household, but the people that you associate with. It's important to know about their work history. It's important to know about their physical health, So all of that is important in terms of being able to diagnose and to help someone, because you can't just look at somebody and say, like a lot of times we want to just size them up. Like, okay, you can't just look at someone. You really have to talk to people. And unfortunately, people think that when they show up for help, that because you're a professional, that you should know. And they say, no, if you don't open your mouth, I don't know.
And again,
so it's important to be able to dialogue. This is a forming relationship, and so I can't help you unless I know who you are. And that's for you to tell me. And it's not about judgment, but it's about really wanting to get to know who you are. So the same thing, because we want to include you in on this conversation in terms of what you offer, in terms of, being a business developer. And so you also have strategies and things that
and I think it's extremely important because there's a commonality with what all three of us do. Regardless of what we're doing, we're counseling and we're empowering individuals. And that's what Seeds of Wealth and Wellness is all about. At the Seed Institute, at the same time, too, an assessment is done with an individual. We want to see where their business is going. So we want to establish what their mission is actually going to be, and then what their vision is going to be. And then we want to establish those goals to achieve that objective. Hang on for 1 second. Caller, you're on the air. Welcome to Seeds of Wealth and Wellness.
How you doing today?
Fantastic. And what is your question?
I'm overweight. I weigh like 420, and I have a fast metabolism, but I can't seem to kick my weight. But I try to exercise, but I can't lose the weight.
Well, caller, you called the right person. We have Hassad Haith on the show here. Hassad, tell us where do we go from here? The gentleman said he's overweight.
Yes, brother. I would like to have an assessment with you.